If you've worked for a government entity or a large corporation, the common wisdom has always been take your retiree benefits, the things you've worked decades to get. But that advice may have turned on its head recently. We're going to go through not only the numbers, but why this could be potentially happening to you in this video. It's only going to take about 10 minutes. You're going to get a great understanding of what your retiree benefits are, how they compare to original Medicare, the stuff that pretty much everybody has access to, and what you should potentially do. And most importantly, again, why this is happening. As always, I'm Ken from NJ Life and Health. Let's dive into, are your retiree benefits still worth it? So when we first started NJ Life and Health years ago, retiree benefits were amazing. Again, we had people who worked for large corporations for decades or government entities, and it was always a no-brainer for them to just keep that particular retiree benefit. And when I say retiree benefit, I'm specifically talking about health insurance related products. So people would come in, they would have really low monthly premiums, they would have really low out-of-pocket costs, and we would say, hey, it's great that you have access to this. We can't help you because we don't have anything that is better. I always remember one of my first clients I ever went to a house call for was a teacher. They had spent decades as a teacher, and they basically had a policy from the New Jersey Teachers Union that said they had $0 in monthly costs and they never had to pay anything when they went to the doctor. I looked at them and said, don't ever get rid of this because this is amazing. But that is starting to change. But recently the math on these plans hasn't been great. So I'm going to dive into some general trends we've noticed. Then I'm going to give you a concrete case study for someone who came into my office just yesterday to go over all these different situations. So the first general trend we're noticing is most people have to pay their Medicare Part B costs. These retiree plans in many cases are connected to Medicare to help subsidize the costs for the plan. So you are going to have to pay the government directly around $185 a month for the vast majority of people. Some people have to pay a little bit more based on their income. But again, everybody, no matter the people that are going to original Medicare directly or through retiree coverage, almost everybody still has to pay this flat Part B cost. You also have to factor in that most of these retiree plans on top of the Part B cost might charge you $300, $400, $500, or $600 a month. This can be very costly relative to what you could get just as a normal person going onto original Medicare and getting a supplement or an Advantage plan. This is a huge cost to people on fixed income, so it is odd that it costs this much monthly now. This seems to have been a pretty recent phenomenon. Like we said, it used to never be this high. It would be like, $0 a month, $100 a month, something very low cost. And on top of all this, the out-of-pocket maxes on these plans can be crazy. So you're paying your Part B cost, you're paying, $400 to $600 a month for the plan itself. And on top of all that, you could still be responsible for somewhere between $6,000 to $12,000 if something truly catastrophic were to happen to you. So the game has changed and we are looking at this objectively. Now, the case study I had yesterday, I'm not going to talk about the specific name. I'm not going to talk about the specific entity that they were about to get their retiree plan, but I'm just going to show you the math that we dealt with that's becoming more and more common as time goes on. We're going to compare this person's retiree plan to what someone might get with original Medicare if they were to go through a broker. So for starters, as you can see, guys, we have Part B on both sides. I'm guesstimating $185 a month because that's about what 90% of people have. But again, right off the bat, in both situations, you have to pay $185 a month. Now, this $185 is going to cover about 80% of your costs. That's why you have to get a couple other policies to help cover the things that original Medicare doesn't cover. So for starters, we're going to get a Plan G. Now, if you're 65 here in New Jersey, a Plan G is probably going to cost you about $150 a month. Varies a lot across the country, so I can't tell you exactly what your cost is going to be. I'm also going to guesstimate about $10 a month for drug coverage. It could be as low as $0. It could be as high as $150. But for the vast majority of people, it's about $10 a month in premiums, which doesn't break the bank. Now, if you want to add in dental and vision, because this retiree plan did have a dental and vision benefit, that's going to be about $45 a person as well. So right off the bat, if we do all the math, $185 a month for Medicare Part B, that goes directly to the government. You get your Medigap or Medicare Supplement Plan G, that's about $150. Your drug plan is about $10 a month, and your dental and vision is about $45 a month. Your total each month is about $390. Now, while that is still a lot for someone on a fixed income, this is very comprehensive coverage across the board, so you won't have to worry too much about other out-of-pocket costs. Now, if we look at the retiree plan, they have that $185 a month, but the retiree coverage was going to cost them $450 a month. So their total cost is $635. This is about 1.5 times what it would be if they were to just go through a broker or somebody else, figure it out themselves, and just go on more traditional original Medicare without the retiree plan. On top of that, if we're looking at the worst case scenario, which is what we all want to look at when we're thinking about different options, original Medicare plus a supplement plus a drug plan is going to have an out-of-pocket max of about $2,257. And the way we get that is Part A, Part B, and a Plan G. Your total out-of-pocket hospital medical expenses should be only $257. Now, that is only for things that Medicare covers, but they do cover the vast majority of medically necessary procedures in any inpatient and outpatient setting. You also have the Part D plan, which is going to have a $2,000 out-of-pocket max. So a very low out-of-pocket max, all things considered. Now, if you go to the other side, not only did this retiree plan have a much higher monthly cost, it also had a very high out-of-pocket max. It was $6,000 per person or $12,000 for the family. And if we just look at everything side by side, again, original Medicare plus the supplement plus all the add-ons, the works, I'm going to say, is about $390 a month. And for hospital, medical, and prescription coverage, your out-of-pocket max is $2,257. On the other side, the retiree plan was costing about $635 a month with an out-of-pocket max of somewhere between $6,000 to $12,000. So not only does it cost you more per month, your total risk in the retiree plan is most likely much higher because of that out-of-pocket max. So the question is, how does this affect you? For years, it was a no-brainer that if you had great retiree coverage from a government entity or a large corporation, you were just going to take it. People like us, licensed insurance brokers, we're not going to have any options that mathematically made any sense for you to take. So now it's becoming a time for you to really look through all of your options and make sure that your retiree coverage is in fact the best for you in terms of cost and coverage, because original Medicare's network in a lot of cases is also bigger too. It just kind of depends on the plan and what the provider network is and how the retiree plan decides how all this stuff works. Because the sad part to all of this, and this is kind of a conversation I've had to have with people, is in a lot of cases, your company wants you off the books. It's very common for these large corporations or these government entities to really give you these great benefits, not only while you're working, but also the promise of healthcare for life and benefits for life to make you want to stick around your career for decades with that promise at the end. But what a lot of people find is that once they get to, that pot of gold at the end of the rainbow and they retire, that it really isn't as good as you want, and they're not ever going to kick you off the plan in most cases, but they're going to make it so disadvantageous for you to take it that you throw up your hands and say, even though I worked for this government entity or this corporation for decades, they actually kind of want me off the books, and that the healthcare they're giving me is so expensive, it actually makes sense for me to leave it. It's this weird thing where they're looking to promise you stuff the entire time you're working, and once you get there, there's really not as much as you thought there would be. Now, all this, again, is very general. This all depends on where you work, how long you've worked there, when you started working, because a lot of these changes in benefits we're finding are more recent. But as time has gone on, they've been sunsetting the most ironclad plans, and we're finding all sorts of other unions are not having the best insurance, and people should actually move to original Medicare with the works like a Medicare supplement, drug plan, and vision plan, or maybe even consider a Medicare Advantage plan depending on all the different needs that person has. So we really want to know what you think about this. Are you looking through your retiree options and saying maybe it does make sense for us to go to original Medicare and get the works and all the extra add-ons? Is your plan super low cost? Do you feel betrayed by the fact that your healthcare at the end of your career is so expensive? So let us know down in the comments below what you think, what notes you have, and if you ever want us to make a video, we're happy to make it for you. We want to cover all these topics, give away this free information for you, because we are NJ Life and Health. And if you want to work with brokers who give a damn and have your best interests at heart, you should work with us. We are licensed in 29 states. We're a local family-owned business that has an amazing support team right here in America that can answer all of your Medicare questions, all of your ACA questions, all your life insurance questions, all your supplementary insurance questions, things like cancer insurance, heart attack insurance, all that. We are a team that really wants to help you. We've helped 5,000 people across 29 states with just those 10, 11 people that you can see on on the screen because we really care, and people spread the word about us because we give them such great service and such peace of mind that they have to tell their friends and family. So please call 848-226-6897 to talk to one of our amazing brokers today. They will guide you through whatever your question is. And if in a situation that your retiree benefits are truly better than what we can offer you, we're going to be honest. We're going to tell you that what you have is the best because we want to pay it forward and make sure people are taken care of. So again, please like and subscribe. Please send this to somebody who you think wants to hear it. And I will see you guys in the next video.